So normal heart sound will be audible at the start of first and second heart sound. Okay, but if the murmur is audible throughout the systole, then it will be called aortic stenosis. Okay, so there will be a crescendo or decrescendo. Okay, systolic murmur. Okay, and if a patient has pansystolic murmur throughout the systole, then it is a mitral regurgitation. Okay, as you can see here. Okay, so mitral regurgitation. And if patient has diastolic decrescendo, okay, like it is audible, first sound is normal, but murmur is audible throughout the second, third, and atrial. Okay, then it is called aortic regurgitation. Okay, when it is there'll be decrescendo, diastolic decrescendo. Okay, and if a patient first heart sound is audible, but from the start of second, third, and atrial, in the you auscultate opening snap type murmur, so it's called a mitral stenosis. Okay, so opening snap. And if the murmur is audible throughout the systole, diastole, okay, so it is called continuous machinery murmurs, which are seen in patent ductus arteriosus. Okay, so I hope the murmurs are clear to you. So normal, there will be start of first and second heart sound, the start of systole and diastole. Okay, it will be audible, that is normal. If is audible throughout the systole, then it is aortic stenosis. Okay, and there will be systolic, okay, decrescendo. And if it is throughout the systole, okay, but is pansystolic type, then it is mitral regurgitation. Okay, and if it is a diastolic decrescendo murmur, okay, during the diastole, okay, so it is aortic regurgitation. Okay, if it is audible throughout the second, third, and atrial, and it is there is opening synapse type of murmur, so it is mitral stenosis. And if it is continuous machinery type, then it is patent ductus arteriosus. Okay, so now talk about the associated murmurs. So if patient present pansystolic murmur, so it will be here best at the lower left sternal border. Pansystolic murmur, okay, will be best here at the lower left sternal border. Okay, and diastolic rumble is best here at the lower left sternal edge. Okay, and so pansystolic and diastolic both are here at the left sternal edge. Okay, and diastolic, early diastolic murmur and ejection systolic murmur both are here best at second left intercostal space. Okay, so pansystolic murmur at left lower external border in chronic ventricular septal defect, shunt reversal with a right to left flow can happen, Esmond's syndrome. Okay, and if you see continuous machinery murmur, so it is best here in the left infraclavicular area. Okay, when it is the pathognomic of patent ductal arteriosus. And if you see crescendo decrescendo systolic murmur, so it is it increased convulsive maneuver and standing up and decreased preload, so it is seen in aortic stenosis. Okay, so you can have MCQs on these murmurs, so you should make them crystal clear. Okay, and by listening this video on your required video speed. Okay, so here is a scenario on aortic stenosis. There is a brain trainer, a 77-year-old woman presents with a mild exercise intolerance, and the ejection systolic murmur is found. Also, what is the likely diagnosis? Okay, so it is aortic stenosis, and echocardiogram is the investigation of choice. Okay, mild exercise intolerance, and systolic ejection systolic murmur. Okay, so ejection systolic murmur is seen in aortic stenosis. Okay, so degenerative calcification is the most common cause in elderly patients, and clinical features for clinical feature. Remember the using this mnemonic AST. Okay, angina, syncope, and dyspnea. Okay, so aortic stenosis diagnosed. Okay, so if patient has angina, then the mean survival is 5 years. If patient has syncope, then is 3 years, and if patient present with dyspnea, then mean survival will be 2 years. Okay, so worsening prognosis. So ASD has a particularly good flow since it also presents a worsening prognosis. The following are mean survival rates if one does not go for surgery. So if patient is not going for surgery and he has angina, so his mean survival years will be 5, and if patient has syncope and is not going under for surgery, then his mean survival will be 3 years, and if patient is not going under surgery but is in dyspnea, then the mean survival year would be 2 years. Okay, so I hope it is clear till now. Okay, so now let's talk about the pulmonary regurgitation. Here is a brain trainer, a 40-year-old man with a cardiac surgery when he was a child has a diastolic murmur at the left upper external border. What is the likely diagnosis? So pulmonary regurgitation. Okay, he had a cardiac surgery, okay, when he was a child and has a diastolic murmur. So pulmonary regurgitation. Okay, so now talk about the mitral regurgitation. Brain trainer, a woman presented orthopnea, widespread basilar crepitation, and pansystolic murmur. What is likely diagnosis? So mitral regurgitation. Okay, so widespread basilar crepitation and pansystolic murmur. So mitral regurgitation. Okay, so here is a mitral stenosis case. A brain trainer, a man presented with a shortness of breath on mild exertion since he returned from Gambia 2 months ago. A chest X-ray shows a sharp straight heart border, and there is a mid diastolic murmur at the apex. Mid diastolic murmur at the apex. What is the most likely diagnosis? So mitral stenosis. Okay, X-ray shows a sharp straight heart border, and mid diastolic murmur at the apex. Okay, so mitral stenosis. In stenosis, a patient will have a shortness of breath. Okay, and so